Hello everyone, I'm Dr. Timothy Keenan. Today I'd like to show you the best way to heal persistent tennis elbow yourself. Cross your arm on your chest, firmly press the round edge of a spice bottle into the muscle just below the elbow bone, then slowly slide it halfway down your forearm and across the painful area. Repeat the procedure 20 times, concentrating your efforts on the most painful region and adding pressure as the tissues warm up. Do this 3 times a day. These are the wrist extensor muscles. If it hurts yet feels good at the same time, you're doing the right thing. If your symptoms include numbness and tingling down your arm and into the back of your hand and you can reproduce them, you're on exactly the right spot and should concentrate your efforts on it. If your pain goes into the back of your arm, add this to your self-treatment. Cross your arm on your chest, firmly press the round edge of the spice bottle into the middle of the muscle just above the painful spot, then slowly slide the bottle downwards across it. Repeat the procedure 10 times and do this 3 times a day. This is the triceps tendon. It's that simple. Try it for a week. If you feel improvement, continue treating yourself at the same intensity until you're perfectly healed. If it's less painful lifting objects and twisting your wrist, it's proof that you're healing and you should congratulate yourself. If you treat yourself as I've described, you should be completely healed in 2 to 4 weeks, depending on the severity of your condition. When you start, it's normal to have sensitive skin for 3 to 4 days as your body eliminates stored up toxins. Light bruising may be normal for some people. If you're taking anticoagulants, take more time and use less pressure in order to avoid excessive bruising. If your skin is too dry, add several drops of hand cream. If you're wearing long sleeves, you may want to change the round edge of the spice bottle for the sharper edge of a small can. The most common errors people make with this technique are twisting the wrist when holding the bottle, rolling instead of sliding the bottle, and sliding the bottle too quickly down the arm, all of which make the treatment ineffective. Never apply heat, including hot baths, since heat increases inflammation. In order to accelerate healing, reduce the intensity of drilling, hammering, sawing, sanding, scrubbing, and wringing cloths. Once healed, if ever you feel the pain coming back, treat it immediately before it gets worse. Finally, in an effort to clear up the confusion surrounding the real cause of tennis elbow, if you heal yourself using my method, it's scientific proof that your tennis elbow was caused exclusively by contracted soft tissues, since that's all my method corrects. This means that even if you can see osteoarthritis, what most people call arthritis, calcium deposits, torn tendons or muscles, bursitis, fibromyalgia, misaligned vertebrae, subluxations, pinched nerves, or degenerated, slipped, thinned, bulging, or herniated discs on your X-rays, CT scans, or MRIs, they have absolutely nothing to do with your pain, so you can ignore them. Only 5% of tennis elbow is caused by things other than contracted soft tissues, muscles, ligaments, tendons, and fascia, so you have a 95% chance of healing yourself when you use my method correctly. That's all you need to heal pain yourself. If you have any questions, feel free to write me. Bye for now and happy healing.